I'm Dr. Natalie Crawford. I'm a board-certified OBGYN and REI, so I'm a fertility doctor. And this channel exists so that you can learn more about your body, health, hormones, fertility, and essentially take charge of your reproductive health, something that we often don't get taught enough about. So please subscribe to the channel, share, ask questions. That way we can spread more health information to more people. I know that when you are starting to try to get pregnant or you're thinking about it, you want to know what you should do beforehand. So what are the changes or what things should you think about before you even start trying to get pregnant? And we're going to go over the top 5 things in this video. As always, I love your questions, so please put them in the comments because these help drive a lot of our future content. The first thing I want to say is that key lifestyle changes that you're going to have to make when you're pregnant, go ahead and make them now. This is going to help you live a healthier life overall, and it doesn't have to be anything drastic. But focus on nutrient-dense food, eliminating processed food and added sugar. Think about changing out the products in your kitchen and in your bathroom so that you're limiting and decreasing toxins. And then think about your behaviors like smoking and drinking and caffeine, and make sure that you are eliminating or decreasing those. Caffeine is a top one that people always ask about. So when it comes to caffeine, there have been many studies done, and not all associations always hold, but intake of more than 200 milligrams could be associated with growth restriction, small babies, miscarriage, and preterm birth. We don't have clear association between caffeine and infertility, but we obviously don't want any of those other bad things to happen. This is typically about 1 cup of coffee, although the big asterisk is not all coffee is created equal. So a shot of espresso is about 75 milligrams. So if you get a grande drink, it has 2 shots, 150. But drip or brewed coffee can often have more. So make sure you're getting a small size, nothing bigger than a tall size. Otherwise, you actually will be intaking too much caffeine, even if it is just 1. As far as the other lifestyle things, marijuana use 1 time a week or more when pregnant has been associated with low birth weight, preterm birth, and stillbirth. So obviously you don't want to have that. No amount of safe alcohol exists in pregnancy. If you are drinking ahead of time, I usually recommend trying to limit it in the luteal phase and don't binge drink or have a lot of drinks on one occasion. And then we know that smoking passes nicotine on to your baby and definitely increases the risk of stillbirth, preterm birth, small babies, and other growth problems. So making some of those changes, hopefully just incorporating them into a healthy lifestyle, that's number 1. But more into the meat of everything else that we want to get over. Number 2 is going to be stop birth control. So if you've been on any type of birth control or contraception, you are going to want to stop that before you get pregnant. And I often get asked, when should I stop this? And the truth is, it is a little bit going to depend on what you're using and how long you've been on it and your period pattern. So the birth control pills, the pill is a combined estrogen progesterone pill. It works by telling the brain that you already have estrogen and progesterone so that you don't ovulate. You can take the pill continuously every single day and have no period at all. You can take it for 3 months at a time and then have a period, or the common pack has you still have a bleed every single month. If you are taking a pack where you have a period every month, you likely are going to have a lot less suppression and a lot less endometrial impact of the pill. So it is okay to take less time off. So I usually say stop the pill about 3 months before you want to get pregnant. That way you can see what your period does, because the pill is not allowing you to ovulate. It's how it works. You don't know what your period's doing. If, however, you have no period at all on the pill, either you're taking it continuously or you don't bleed, you should take 6 months off because it's going to take longer, potentially, to get a lining thick enough. A progesterone IUD, same rules apply, but because of the daily progesterone exposure, we see a really profound thinning of the endometrial lining. And I usually recommend you get this out 6 months before you want to get pregnant. That way your lining has a way to build back up. A copper IUD does not impact ovulation or the lining. It has an inflammatory response. So as soon as you take that out, you should be able to see what your period is, and you don't need any amount of time to track a cycle because it's not impacting ovulation. And then Depo-Provera, the shot, is a big one. The shot you have to get every 3 months to have a high enough progesterone level to prevent ovulation. And obviously, if you're using it for contraception, that's what you want. But 1 single shot could last for 18 months. So if you think you're going to get pregnant in the next 2 years, please transition off of Depo-Provera. Now, all of these things, I just want to say, doesn't mean that you can't get pregnant that timeline, meaning you get your IUD removed, you could get pregnant next month. But if you're trying to optimize, one of the things that we want to do is get your uterus time to recover if it had prolonged progesterone exposure and give your ovaries the ability to ovulate, which should start right away. But we want to see a period pattern, which obviously takes more than 1 month. So number 3 is going to be track your cycle. And you don't have to do anything fancy. You do not need to start by using any expensive kits, any fancy tracking. Of course, if you want to, there are some great options that exist. But I think that the easiest thing to start is just knowing cycle day 1 and start marking it on your calendar and see if it's occurring at a regular interval. A regular interval should be regular and predictable. You should be able to look at the calendar, and within 1 to 2 days, you should be able to mark, hey, this is my period start date. And if you're off by 5 days, 7 days, 10 days, those can be signs of irregularity, and you should go get that evaluated because there could be something really bad going on. There could be something contributing as to why you're not ovulating that may have nothing to do with birth control. So even if you've not been on birth control, you should track your cycle so that you know I have a regular, predictable cycle. That is the top sign that you are ovulating. Now, if you want to track ovulation specifically, I do have some videos on tracking your cycle, but the easiest, cheapest, free way is going to be cervical mucus monitoring. So with this one, what you're going to do is you're going to wipe, separate labial lips and wipe at the vulvar surface and look at the toilet paper and see if you've got stretchy, thick, egg white cervical mucus. That's called type 4 cervical mucus, and that's associated with ovulation day, peak estrogen, and that's when you're going to target timing intercourse. But to start, you just want to track your cycle and know that it's occurring at a regular interval. And if it's not, schedule an appointment with your OBGYN so that they can start to look for causes of irregular cycles. Do not try to get pregnant for any amount of time if you know your periods are irregular. That's going to make this much harder. Number 4 is going to be start a prenatal vitamin. And I get a bajillion questions about prenatals and what do you need and what's best. And I always say the best prenatal vitamin is the one that you're going to take. But one important component is going to be that it has folic acid. Now you need at least 400 micrograms, mcgs of folic acid. And folic acid is a B vitamin that's an important requirement for cell division. And really early in the pregnancy, cell division is essential for what we call the neural tube, the spine and the brain. And having a deficiency in folic acid can impact that growth. A lot of modern prenatals will add methylated folate. It is further down in the metabolic pathway. And this actually might be better for some people. It might make you feel better. It might be better for Natalie, who's not trying to get pregnant. But there's been no study, nor will there be any study that shows that methylated folate prevents a neural tube defect. And we know that folic acid does. And it is not worth it risking having one of these terrible outcomes. I've had patients with neural tube defects, anencephaly, and it's terrible. So have a prenatal vitamin that has at least 400 mcgs of folic acid. If it has methylated folate too, great. If your favorite prenatal on planet Earth has methylated folate, please just buy a very cheap over-the-counter folic acid pill also and just take them both. Most prenatals are going to have pretty much the same gamut of the other stuff, which is going to be vitamin D, it's going to have some B vitamins, vitamin C. Typically they have iron in them, calcium in them. I do love if your prenatal also has omega-3 fatty acids and if it has some choline, which can be helpful for development of the baby's brain. But if you were going to take one single pill and one single nutrient, folic acid would be the recommendation. Number 5 is going to be schedule a preconception visit with your OBGYN. You may not even know that this exists. Your OBGYN, this is their favorite visit, I promise you. This is I don't have infertility. I've not yet started to try to get pregnant. I want to make sure everything's okay. They will review some of the things we just talked about, make sure you're on a good prenatal, answer any of your questions about fertility and getting pregnant, how long is too long. But they're also going to check some important preconception blood work that could alert you to being a higher risk for other problems or could change your plan. This blood work typically includes a blood type, proof of immunization to rubella and varicella, which are both viruses that can cause very severe birth defects. And then also you should be offered genetic carrier screening. Genetic carrier screening before you get pregnant is just blood work. Nobody says that you have to do anything with this blood work. Nobody says that you're going to be forced into IVF. but it allows you to know if you and your partner carry the same genetic disease. And you can't make decisions on data you don't know. So if you both find out you carry the same genetic disease, you now will be in a position that you can at least evaluate, is this something you want to talk to an IVF doctor about and consider screening out of your family? Some of these diseases are lethal, and that may be worth it. Some of them are not. And I've had a family who both carried a gene for congenital deafness, and they decided not to screen it out. But because they knew, they started taking sign language and becoming involved in the deaf community. And when they did have a non-hearing child, they were very prepared versus finding that out when they're in the hospital postpartum. They felt like they were much more in charge of that situation. So there's no right or wrong decision, but getting the data allows you to be in the position to make the decision. And otherwise, you are not. There's also genetic testing for cancer carrying diseases. This is different. If you have a lot of cancer in your family and you do carry a cancer gene, that can be tested out with IVF. So definitely talk to a fertility doctor to learn about it. And often this preconception genetic carrier screening is different than what's happening on your ancestry or your, over-the-counter DNA test. So some are the same, but many, many are different. So just know that it's a little bit different test. It's just blood work. Now, those are the 5 top things for you to think about and to do before you even start trying to get pregnant. So that is going to be make some lifestyle changes, take a prenatal vitamin, schedule a preconception visit, stop any contraception you're on in an appropriate time, and track your cycle to see if it's regular. And then from there, we can learn a lot more about cycle tracking, and we'll do some more videos about what to do when you start trying to get pregnant coming up soon. As always, ask your questions below, share, subscribe. Thank you so much. And you can always get